This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning, everybody. Quick medical minute on a side effect of a medication that we use a fair amount here. So we give a lot of thrombolysis for stroke, and we think about the main side effect being bleeding, or the main problem being bleeding. But there's kind of an unusual and interesting thing that can happen with whether it's TPA or TNK that's being used for thrombolysis, and that's angioedema. And it's not very common. Studies show that it happens about 1 to 5% of the time. So we will see it. For every 100 times we give TNK, we might see it 1 to 5 times. So it's something we should be aware of. And it's an interesting phenomenon that's based on some histamine release, so like a regular kind of allergic reaction, but also there's a component of bradykinin, so more of like a hereditary angioedema or ACE-induced angioedema pathway. So it's a little complicated pathophysiology, but you can end up with angioedema, and it can be the lips, the tongue, and it can also be more laryngeal, so potentially more concerning. It happens most of the times as the thrombolysis is being infused, but it can happen up to 24 hours later, so it's something to keep an eye on even in the post-treatment phase. Initially, if the person's still getting their medication, which, TPA is an infusion, TNK is not really, but if you can stop the medication, and then initially we would treat it like a regular angioedema allergic reaction, so there is some role for antihistamines, steroids, sometimes epinephrine, so the usual things we do for allergic reactions we should do. Obviously, a big thing is airway monitoring. So if somebody needs airway control, it's something that we'd deal with. And then rarely the medications that are used for hereditary or ACE-induced angioedema, the more complex medications like Berinert or icatibant can be used, but that's probably pretty unusual that we would use those further down the line. Usually it would be the regular allergy stuff and then airway control if needed. One interesting thing was they do say that it's about 4 times more likely in patients who are on ACE inhibitors. So it's kind of an interesting thing. I haven't seen it a lot, but it is something that probably will happen every so often with our patients getting thrombolysis.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.